So, how do you know if a site staff has adequate time? That's a job interview question too.
Well,
That would indicate three things that would indicate the coordinator doesn't. Let's go with coordinator.
let's say, for instance,
Let's break it down. CRC first, and then PI. Okay.
PI.
So CRC first, and then we'll do PI. Three things. It's an
Okay.
interview question. All you need three things.
So for the CRC, I'm thinking if depending on the number of subjects that are being seen, if it's a lot in number and she's the only one at that location at that site doing all of that with no other sub investigators, that could show in the documents, you know, maybe.
But
if
what
she
would
has
show in the
gaps.
documents?
Gaps in, you know, information, following up with things, following
Okay, so
up with
missing info and
missing
source.
information, yeah.
That's one. What about in EDC?
In EDC, missing information
Missing
too.
data or old queries not answered?
Yes.
Okay. And what's another one? There's probably more than three, but three is enough for interview.
Another one.
So inadequate source documentation
Mhm.
and slash maybe many errors, right?
Errors, yeah. It could show up that way.
Okay, so that's one. Number two is missing data, old queries in the EDC. And what's the third one? A giveaway, a sign that the coordinator is overworked and doesn't have enough time for this study.
For the study. If you talk to them and maybe they're involved in, oh no, that's the PI.
That's PI. We wait for him or her
Yeah.
later. But what about
Filing. Oh, that's still part of it.
there you go. No.
Filing documents.
Investigator
yeah.
site filing. That's perfect. Okay.
Yeah.
A fourth one would be like you talk to the coordinator or
And,
a fourth one would be
communicate that.
yeah, well a fourth one even simpler would be the coordinator doesn't have time to even meet with you. It's obvious.
Yeah.
You know?
That's true.
That's a fourth one.
Yes.
A fifth one would be what were we gonna say? I don't remember, but that's enough. That's enough for the interview. Investigator site filing is all misfiled, missing,
Yeah.
not up to date with amendments, trainings.
Yeah.
Okay, that's not enough. These things, one of these things by itself, it's just an issue, but in combination, it becomes more of a systemic issue,
Yes.
which is what the question's referring to.
Okay.
So this is kind of how you go about doing that. You wouldn't know in this case because it's not, you know, this was a real study, but it's not like a active. Tomorrow you will know.
Okay.
Tomorrow you'll know. Okay.
All right.
Now what about PI?
PI
What are three signs?
hardly available.
Yes, 3 signs that the PI doesn't have enough time for the study. So not available.
And
That's one.
when they're available, they rarely have time to meet with you.
Okay,
Very
well that's the
limited
same
time.
one. That's
Very-
the same
okay.
one.
Okay. PI oversight.
There you go.
They're missing. You know, they're not reviewing the
PI
presentation,
Yep.
the trial itself,
Yep.
and if they're involved in too many other trials. If you
Yeah.
have that information, yeah.
Right, because sometimes people at the site like to talk to the monitor. So
Mhm.
if the coordinator tells you, hey, maybe they let it slip, hey, the PI is almost never here.
Yeah.
He's hard for me to get a hold of him. Then you have a verbal report from the coordinator
Yes.
that even they have a hard time getting the PI. So you know
And
what do you
other
do in those
things-
cases then? Like what?
Other things maybe that he's supposed to follow up on. Oh, well, that's still oversight.
Yeah, that's oversight. Like kind of handles
Yeah.
A lot.
A lot. Yeah.
you can break oversight down and make more, which is good for interview.
Yeah.
But what do you do in this case? More importantly,
For the Coordinator.
Yeah, like what would you do if this were the case besides writing it in your report? I mean, that's really all you can do in both of these cases is just put in your report.
Yeah, put it in your report so it goes to the project manager, to the medical monitor,
That's right.
to
the
look at
sponsor
how
eventually.
appropriate, yeah, it is for that site to continue the trial. If,
That's right.
Yeah, things are not getting done.
Especially if there's a lot of queries,
Mhm.
and then even worse if they're a high enroller site,
Yeah,
which happens a lot
I
actually.
can imagine.
Especially with these key opinion leaders that the sponsors love.
I heard about key opinion lead. I heard about that yesterday for the first time from Chris.
Not from Chris.
Yeah.
Chris knows what's up.
Yeah, he does.
Chris knows what's up. Yeah, KOLs. They're usually at universities, like Johns Hopkins.
That's
for
what I heard, yes.
example, right? They usually can get away with these things because the sponsors
I
love
better
them.
not say that. I'm still trying to get hired.
Yeah, maybe you need to get hired there, so maybe we keep that one quiet. Good thing they don't know who you are.
They do.
They will soon. But no, those are good. So what else? What else?
Okay, so, how to handle it.
Yeah, I mean, that's
I
not
don't
much.
think, you know.
How would you handle
don't
it
have so
before
much-
you escalate it to the sponsor? Like, you're still gonna put in your report, but then it would be nice if.
It would nice to talk to the PI.
That's
to
right.
Think about,
That's right.
hiring, put it in more people.
And what would you tell the PI about, let's say
I will
the
mention.
coordinator is overworked, and it's obvious to you the
Yes.
coordinator is overworked,
Mhm.
and this is important because maybe they don't know.
Mhm.
Maybe they're just thinking
Yeah,
the coordinator is
you
complaining
let
too
them
much,
know, how it's reflecting on the trial.
and on
And
them,
it would be nice to have more people to work in.
and
to
how
get
it's
this
reflecting poorly
Mhm.
on him.
On him. Yeah, ultimately, yeah.
Perfect.